All right, so we're gonna go over the arteries of the body. So the first artery coming out of the left ventricle is going to be the aorta. The first part of the aorta is the ascending aorta. Then we have the aortic arch, the descending aorta, and then behind the heart it would be called the thoracic aorta. Now the branches of the aorta include the brachiocephalic trunk, which is here, and most of it's hidden behind this vein here that we'll talk about later. But this is the brachiocephalic trunk, and then it's going to branch into the right subclavian artery, which means underneath the clavicle, and then the right common carotid artery coming up the right side of the neck. The next branch off of the aortic arch is the left common carotid, which starts here and then goes up the left side of the neck. The next branch of the aorta is the left subclavian that will go underneath the left clavicle. Now, once the aorta pierces through the diaphragm, then it's called the abdominal aorta. This entire vessel here, large vessel, is the abdominal aorta. The first branch off the abdominal aorta is the celiac trunk, which is just right here. You only see a small piece of it because it's going to immediately branch into other directions. So celiac trunk just here, and then it branches into the splenic artery going out towards the spleen, and then the common hepatic artery going out to the liver. The next branch off the abdominal aorta is this little nub here, number looks like 126, and that is the superior mesenteric artery. And the superior mesenteric artery delivers blood, including oxygen and nutrients, to the small intestine and part of the large intestine. The next branches off the abdominal aorta are the renal arteries, and renal means kidney. So this is the right renal artery here and the left renal artery there. The next branches are the gonadal arteries, which are here, right gonadal, and then left gonadal. You can refer to them as testicular for male and ovarian for female. However, you want to make sure that you stick to gonadal because it's easier to learn one, and also you don't want to get your males and females mixed up in case you receive a male or female model on the exam. The next branch is the inferior mesenteric artery, which is here, and then that's going to deliver blood to the remaining parts of the large intestine. Then the last branches off the abdominal aorta are the common iliac artery. So here's the right common iliac and the left common iliac. The next branch are the internal iliac arteries, which are here. That's the right internal iliac, and then left internal iliac artery. Once we get past the internals, then here they're called the external iliac artery. So right external iliac and left external iliac artery. We're going to keep going down. Once we get next to the femur, that is the femoral artery. This one here is the left femoral artery. You can see it a little bit here. Here's the left femoral or right femoral artery here, but a lot of it's cut off to see deeper vessels that you're not responsible for. So left femoral artery, and then here would be right femoral artery. This leg here is turned out so that we can see the back of the leg. So once the femoral artery extends and goes behind the knee, once it's behind the knee, it's called the popliteal artery. So you can only see the left popliteal artery on this model because it's hidden behind the knee on the right side. From there, the popliteal artery will then branch into your anterior and posterior tibial arteries. So on this leg over here, all this here is all anterior tibial. That's the anterior tibial artery on the right side. And then on this one here, again, this is popliteal, and then it branches into the anterior, which you can only see a small piece of it right here on 43, but then you can see it again right here. So that's still anterior tibial there. And then Again, only on this leg, because this is the only one where you can see the back side or posterior side of the leg. This is all posterior tibial. So that's the posterior tibial artery. There is one branch of the posterior tibial artery, that is the fibular artery, which is a small branch here that's cut off. So posterior tibial extending all the way down the leg, the fibular artery on the left side here that will eventually go to the lateral side of the leg, which you can't see. Extending down to the foot, so this is all anterior tibial artery. Once we get here to the top of the foot at number 45, that is called the dorsalis pedis artery, and this would be the right dorsalis pedis artery, and that is a major pulse point of the body, so you could feel right there to measure someone's pulse. Then you can see it make an arch here, and then that's called the arcuate artery, so this would be the right arcuate artery. And then that extends to the metatarsal arteries because it begins at the metatarsal. So those would be metatarsal arteries. You can't see these on this model because you can't see the top of the foot. So I won't ask for any of these vessels on the foot on this side. Then we're going to come all the way up so we can do the arms. So we already said that these were the subclavian arteries. Once we get to the armpit region, like right here at, looks like number 17. Once we get to the armpit region, that would be the axillary artery. So this is the left axillary. Over here would be the right axillary. Then once we get next to the arm, or next to the humerus, that would be called the brachial artery. You can see that over here as well, the brachial artery. Once we get to the elbow, then it's going to split to your radial artery on the thumb side, because that's where the radius is, and then the ulnar artery on the pinky side, because that's where the ulnar is. Then you can see the palmar arch here. Now technically this would be the deep palmar arch because it's touching bone. So you should refer to it as the deep palmar arch on this right side of the model. So, and then from there, it's going to extend to the digital arteries here. On this side, the arm is pronated. And so you can see the beginnings of these arteries, radial and ulnar, but I wouldn't ask you on this side because it's twisted and confusing. I would ask you on the right side here. But then over here, this is what would be the superficial palmar arch right here on this side. And then these are the digital arteries. And then if you come up here, I wouldn't really ask you. I would ask you on the transparent skull model, but I'll show you anyways. This is the common carotid on the left side, and then it splits into the internal and external carotid. So this one would be the external that's coming up to the outside of the skull. So this is the left external carotid, and then number 8 here, that is the internal carotid. It's going to go up and into the brain. But again, I wouldn't ask these two on this model. I would ask on the transparent skull model. And that's it for arteries.